Good morning, Tracer Man. As our temperatures continue to climb, I hope that you and our listeners are finding ways to stay hydrated and to stay cool. Today's show is primarily focused on women's health issues, specifically symptoms that may indicate cancer. However, I think it's important for men also to hear this same message to better understand some of the issues facing the women in their lives and to gain a better understanding of the personal health issues and health risks for women. Did you know that the three leading causes of cancer deaths among men and women are number one is lung cancer. It is estimated that 226,000 men and women will be diagnosed with, and 160 men and women will die of lung cancer in 2012. With breast cancer, it is estimated that another almost 227,000 women will be diagnosed with, and 40,000 women will die of breast cancer in 2012. Colorectal cancer is estimated that 143,000 men and women will be diagnosed with, and almost 52,000 men and women will die of colon cancer. These are really high numbers. As women, we are often busy with family activities, and we sometimes don't pay enough attention to ourselves. We often tend to shrug off minor aches and pains and other warning signs that may signify something more serious going on. So this message is for all of you women out there, young or not so young. Here are 10 cancer symptoms you should not ignore. You don't need to panic, but you shouldn't assume these signs are nothing either. If you have some of these symptoms for 2 weeks of persistent and progressive activities, that something is not right, you should call your doctor. Let's look at these 10 symptoms. One is any changes in the breast. If you feel a lump, you shouldn't ignore it, even if your recent mammogram is normal. If your nipples develop scaliness or flaking, that could indicate Paget's disease of the nipple, which is associated with an underlying cause, cancer, in about 95% of cases. Any milky or bloody nipple discharge should be checked out. Dimpling of the skin over the breast, particularly if it looks like the skin on an orange, is something to be concerned about. Such dimpling is most often associated with inflammatory breast cancer, a rare, usually aggressive cancer, characterized also by swollen, hot, or red breast. Expect your doctor to do a breast exam and medical history, followed by a mammogram or sonogram, and perhaps a biopsy depending on the results of both tests. If you're experiencing any irregular bleeding that is uncharacteristic for you, spotting outside of your normal menstrual cycle, or heavier periods should be looked into. Around menopause, abnormal bleeding is often attributed to hormonal shifts, though more serious problems could be the cause, which is why all abnormal vaginal bleeding should be evaluated. Expect to receive a transvaginal sonogram and perhaps a biopsy. If you're experiencing any rectal bleeding, colon cancer is the third most common cancer in women. One of the hallmarks is rectal bleeding, which many people attribute to hemorrhoids, the most common cause, but it's not always that. Red or dark blood in your stool warrants a visit to your doctor. Your doctor will likely do a rectal exam and order a colonoscopy if you're 50 or older, and perhaps even if you're younger. If you're experiencing any vaginal discharge, a smelly vaginal discharge could be the sign of cervical cancer. The discharge may contain blood and may occur between periods or after menopause. It's best not to self-treat a discharge with over-the-counter medications. An exam is necessary to determine if the discharge is due to an infection or something more serious. If you're experiencing bloating, ovarian cancer is the number one killer of all of the reproductive organ cancers. For years, it has been known by the misnomer of the silent killer, and we really need to put that aside. Ovarian cancer clearly has symptoms. The four most frequent are bloating, feeling that you are getting full earlier than you typically would when eating, changing bowel or bladder habits such as urinating more frequently, and low back or pelvic pain. It's not unusual to have one or two of these symptoms occasionally, particularly after a large meal, but pay attention if you have two or more symptoms occurring daily for more than 2 weeks. If they're persistent and progressive, call your physician. Expect a pelvic exam, transvaginal sonogram, and perhaps a CA-125 blood test to check for cancerous cells. Let's take a break here, Tracer Man, and when we come back, we'll finish the list of these warning signs and then talk a little bit more about what we can do to minimize our risk of cancer. Let's continue with our list of symptoms of cancer. If you're experiencing weight gain or loss, if you suddenly put on 5 pounds, I wouldn't worry. But gaining excess weight month to month, especially if you usually maintain a normal weight and watch what you eat, can be due to an accumulation of fluid in the belly related to ovarian cancer and warrants seeing your doctor. Unexplained weight loss of 10 pounds or more may be the first signs of cancer, according to the American Cancer Society, and is most often associated with pancreatic, stomach, esophagus, or lung cancer. But weight loss in women can also be caused by a hyperactive thyroid. Expect your doctor to order a thyroid test first to check for this common disease. If you're experiencing any persistent cough, one that lasts more than 2 or 3 weeks and is not due to an allergy or upper respiratory infection, or one that produces blood in the sputum, needs to be checked out by your doctor. If your cough may be caused by smoking or being exposed to secondhand smoke, get it checked out. Smoking is the #1 cancer killer of women. Yet, you don't have to be a smoker or to be at risk. The majority of lung cancers that occur in non-smokers also occur in women. Expect your doctor to order a chest x-ray and probably a CT scan. If you feel any changes in the lymph nodes in your neck or under your arm, you should be seen by a doctor. Swollen, firm lymph nodes are often the result of an infection. However, lymphoma or lung, breast, head, or neck cancer that has spread can also show up as an enlarged lymph node. Expect a physical exam and possibly a biopsy. If you're experiencing fatigue, although fatigue can be hard to quantify, the American Cancer Society defines it as extreme tiredness that does not get better with rest. If you're persistently fatigued, see your doctor. Leukemia, colon, or stomach cancer, which can cause blood loss, can result in fatigue. Fatigue can be a serious problem and it's easy to ignore. Your doctor will most likely do a physical exam and order blood tests to evaluate your thyroid and rule out a thyroid condition. And finally, keep an eye on any changes you notice in your skin all over your body and call your doctor right away if anything concerns you. Sores in the mouth that don't heal, especially if you smoke or drink alcohol, may be a sign of oral cancer and should be examined by your physician. In particular, note any soreness or irritated skin in the vaginal area. A non-healing vulvar lesion could be a sign of vulvar cancer. Changes in moles or pigmented lesions on the vulva can also signify cancer. Vulvar melanoma can frequently be overlooked and can have a very progressive course. A simple biopsy can be done in your doctor's office if necessary. The bottom line is watch for all these symptoms, but remember, while it is important to be on the alert for physical changes, this information is not an attempt to make you paranoid or cause you any undue harm. Don't be afraid. If you notice something different about your body, get it checked out. Most likely it's not cancer, but if it is, most cancer is treatable. Often it's curable, and clearly having a diagnosis earlier will allow you to have the most benefit possible from current healthcare advances. Now that you are more aware of the warning signs you should not ignore, let's briefly discuss 3 ways to minimize your cancer risk. The first is know yourself. Make a family health tree. Know your family history. Know what you're at risk for so that you can focus on screenings and preventions. Moreover, you're just as likely to inherit your risk of breast and ovarian cancer from your father's side of the family as your mom, so don't rule that out. Check your BMI. Make it a habit to know your body mass index and keep it under 25, the dividing line for being overweight. Regular exercise can lower blood estrogen levels, which helps to cut the risk of breast cancer. And finally, schedule screenings. Make sure you get a colonoscopy if you're 50 or older, and schedule regular pap smears starting 3 years after first intercourse or no later than age 21. as well as mammograms after 40, according to the American Cancer Society. Although cancer is not a pleasant subject, being more aware of the warning signs and seeking a diagnosis early is extremely important. I've had several friends diagnosed with cancer recently, and it's made me much more aware of the warning signs. And so I'm urging you, to pay attention to what's going on with your body and not ignore things when you feel like there's something going on. So that's it for today. Until next week, be kind to one another, be happy, and above all, stay healthy.